Is Steve Tappenden here, please? Okay, Steve, do you have a question with you? You've got a question with you. We're on to health and a question from Steve Tappenden.
If you're elected as our MP, what would you do to make sure that the promised move by the UK Health Security Agency to the pinnacles will take place, giving a much needed boost to the local economy, jobs and businesses, and that the desperately needed new hospital will get built with no further delays?
I've had stories about new hospital 2024, 26, 28, 30, and I think I'm on to 32 now, in the 11 years. So on that basis, invite you to answer the question, and Yasmin first.
Thank you for your question. So, with the public health building, I've seen it go from GSK, actually worked in there, and to being a shell of itself. And then it was earmarked for testing in the Olympics. It's always had all these different labels that could be applied to it. What I would like to see is, I would like to use some of this lift and shift money from £29 billion that's been promised to us, to lift and shift PAH hospital, to decamp patients up to that unit, and then we can start building on the hospital, repairing the hospital where it is. I can't see the point of going on and on about the hospital when they haven't even purchased the land. That's quite essential. If you're going to build a hospital, you need some land. So that would actually do that in the short term, and it would help with the hospital. I don't know what's going to happen to that building. I don't know the promise of jobs. We hear so many promises. I just want to see real action, and I just want to see that hospital fixed so people can be fixed.
UK Health Security Agency, the new hospital. What can you tell us?
Okay. I mean, in respect of the Health Security Agency, I think all backbench MP can do is lobby as hard as possible, both within Parliament and with the relevant ministries to try and get it done. I'm not going to say there's anything in our manifesto about this. There isn't. That detail isn't in there. So, as an MP, the question is, would I diligently and effectively lobby for it? Yes. Could I promise it? No. In respect to Princess Alexandra, I've actually had good cause to spend some time in Princess Alexandra, but not as a patient. I can see that it needs rebuilding. What I would say is hospitals need a minimum catchment population. They need a minimum size to have critical mass. So this doesn't actually only affect this constituency. A rebuilt Princess Alexandra will have to also serve patients from North West Essex and East Hertfordshire. So there are a lot of complications to it. I'm not going to pretend I know all the answers. I certainly think it's needed. There's certainly lobbying in Hertfordshire for additional hospital capacity. So I suspect it will happen, but exactly what form it takes and when, I don't know.
Chris.
Give us a promise. Give us a date.
Thank you for the question. And I think generally, I think there's a key theme already coming down that people in this town feel let down. I've spoken to our party leader Keir Starmer a number of times about the new hospital for Harlow, whenever he's come to Harlow, and I've got a firm commitment that the next Labour government will ensure that the new Princess Alexandra Hospital is built. And that's something that I, as from a personal point of view, as your MP, I will make my top priority. And judge me on that record, absolutely, but I will do everything I can in my power to ensure we get a Princess Alexandra Hospital. Comment was made earlier that it's very likely we'll have a Labour government. If you have a Labour government, you've got a Labour MP in Harlow, I'll be banging on the door of the Prime Minister to ensure that Harlow gets the new Princess Alexandra Hospital that it desperately needs, because the current one is falling apart, and many people in this town are hugely disappointed by, frankly, empty promises from the current government. The new 7A junction. Coming on the Health Security Agency, if I may, I'm not going to make you any promises about the Health Security Agency, other than the fact I share your disappointment. I've been having Michael and Martin who've been involved in that project. And I have to say, last time I had that conversation with them, there were some very glum faces because actually the cost of that project has spiralled out of control. And that's another example of mismanagement of the economy, unfortunately, by the current government. I absolutely want to bring investment to Harlow, I want to bring high tech jobs to Harlow, and that's something I will endeavour to do.
Thanks, Steve. I want to see both moving to Harlow. On what was Public Health England, I share your frustrations on that. The whole structure of that got redone during the pandemic, and I think there have been conversations about what and how that now moves. That is frustrating, and if I was your MP, I would want to get stuck in there, work out what is happening, and make sure we still bring it to our town, because it's going to provide so many opportunities. We've already had lots of businesses and enterprise spring up around that in the sort of life sciences sector, and I would like to see that continued. On the new hospital, when I was working for Rob, I worked on a lot of the campaigns for both of these things. I will do everything in my power to get it here. It is committed to by the Conservative government. They've already spent £10 million on all the plans and preparation work for it, and the site is being negotiated at the moment. Chris may have had commitments for the new hospital from his bosses, but they have also committed to reviewing all capital funding going into the NHS. So they've made two separate commitments there. Which one it is, I don't know. But the Conservative Party is firmly committed to the new hospital. I've spoken to the new hospitals minister twice since I've been selected in the last few weeks, and he's come to Harlow to speak to me about that on one of those occasions. So if I'm your MP, I will fight day and night for both of those things until they are open to the public.
Look, the UK HSA and the hospital are just two examples of broken promises by the last Conservative government. We cannot get away from that, right? They're broken promises. Where you've got a Conservative MP and a Conservative government, that's what's happened. Having a Labour MP and a Labour government, it's not going to change it because he's had commitments, right? So I'm just going to put that out there because it's really important. Look, as an MP, what I can do and what I promise is within the first 100 days is have a public meeting with me, if I'm elected, with me and all the stakeholders from the hospital and the agency. Because my previous work is about delivery. And this is not about hard-working MPs. This is about hard work. By the way, you should expect MPs to work hard for you. That is not a USP, and nor is it a badge of honour. It should be about delivery. And I will deliver, within the first 100 days, that consultation, a public conversation, in here or wherever, with all the different stakeholders. Because what you can't do is sit here and they're going to ignore you. As an MP, I can bear that pressure onto them and come to the public, talk to them, explain your ideas, explain your strategy, how you're going to deliver both the hospital and the agency. Thanks.
Thank you, Steve. The biggest issue, quite clearly, on this one is the fact that we are getting a bit fed up of a lack of conversation, a lack of feedback, a lack of clarity. And if I was in that position, I would make sure that we got some clarity ASAP from the minute I was elected. Simple as.
Steve?